Good Wednesday morning, everybody. I hope everybody's having a good day. It's James with Going Enterprises LLC on the Square in downtown Girard. Welcome to another episode of Weekly Rant Wednesdays. Today's topic, health insurance and the ridiculousness thereof. Today's video is sponsored by, of course, new TikTok rules. Got to put this out front. Sponsored by Goings Innovations. Train whistles. This is a real thing, guys. We sell these quite a bit at events that we go to, and it just does my heart good to watch little kids running around shooting on these things and just driving everybody else nuts. I don't know why. It's the kid me. But available on TikTok shop, also merch links on bio. Check it out. So let's get into it. Health insurance, guys. Health insurance, the cost of health insurance is freaking stupid. Okay? Why is it stupid? Well, the cost is outrageous. Insurance companies have way too much control. Even after the expensive premiums that we pay, the insurance companies have way too much control over our health care. I kid you not. The doctor that I had since I was a toddler, I'm in my 40s now, right? He just retired. But anyway, he had no problem telling me that the insurance company was his boss. So a little bit of a quick rundown with my autistic ranting and not being able to stay on track. I'll see what I can do. See, I'm already doing it. So I was a pre-med student, believe it or not, and then I switched to electrical engineering when my GI Bill got screwed up. So when I was a pre-med student, working on my biology degree at a local college, at a local university, they explained to us in one of our classes about the runaway insurance plan. And they broke down for us basically anything and everything in the healthcare system has to be insured with a specific type of insurance. And fast forward to my college days just a little bit, I worked in machine shop for over 3 years. During my time at the machine shop, we were looked at as potentially contracting to produce specific medical implants. And for us to produce those, the reason my boss eventually told him to apply type was because he started researching every bit of insurance he would have to have. And there was a specific type of insurance just to machine, high precision machine, these medical implants. Okay, you look at that, take it for face value, okay, that makes a lot of sense, and it does. However, the supplier of the material has to be insured. That cost is passed on to the machine shop. So then, the machine shop machines those particular pieces and makes the implants, right? Those implants go up to the seller of the implants. The seller of those implants have to have a specific type of insurance. So you're getting, now the insurance cost has been passed on 3, maybe 4 times at this point. Then it goes to the hospital. Now the hospital, who is also passing this on to the patient, has to be insured for that specific type of implant. Not to mention, everything has to have a specific type of insurance to be utilized in that operating room. Okay? Everything. The physicians and the nurses, well, mainly the physicians doing the job, have to have very specific type of insurance. There's a reason, guys, you're not seeing physicians with their own ERs in family practitioner offices. Okay, let's say, so I had my rotator cuff repaired about 1.5 years ago. When this happened, well, it was about 1 year and 4 months. Even though it was maybe an outpatient. I don't know if they considered it an outpatient. I did it in a clinic. Okay? That clinic owned and operated by a much larger hospital. The physician, the surgeon that worked on my shoulder, was not in private practice at this clinic. He worked for a hospital. Why is that? Because, guys, insurance has gotten so freaking stupidly expensive, even from a physician and a doctor's and surgeon's standpoint. Regardless of what level you're at, insurance is so stupid, these guys are having to work for a corporate-owned and operated hospital just to be able to afford the insurance. Because then that insurance gets taken care of by the facility, by the hospital, right? So, another quick story. I used to work 911. I worked 911 for 6.5 years. And during that time, that was when the Obamacare, the Fair Health Care Act, whatever they call it, went into law in 2014. So I went from my insurance being covered by the county I worked for. It was great. That following year, when it was the precursor to Obamacare, they were like, well, the county can no longer afford to cover 100%, so what we're doing is now you're going to have to pay, I think it was like $10 a month out of my check. Okay, that, at the time that was a partial tank of gas, which kind of was an issue, but it was alright, you know. I was very healthy. I did not have to go to the doctor a lot. So at that point, insurance was then being required. Well, then, that following year, everything kicked in to where Obamacare was full bore, right? So when it kicked in, now my insurance, just on me, the mandatory required insurance that had to be taken out of my check was between $40 and $50. I think it was like $43 if I'm remembering correctly, something like that. And they flat out told me, this was not for you. This is a portion that legally you are required to pay for other people that can't afford insurance. Guys, I was bringing home anywhere from $1,200 to $1,400 a month after everything was taken out of my check. I was a single dad, a single father, raising a preteen boy on my own. Okay? Both of us very healthy. Didn't have to have a lot of doctor's visits. But then my son started having issues with his shoulder. Okay? They tried to force me into the family package, the family health care package for insurance. They were going to be taking $435 a month out of my check. I was bringing home $1,200 to $1,400 a month. That would have been a huge chunk out of my check, right? So my son started having shoulder issues. I knew what the problem was, but I didn't want to take the risk of being wrong, so we jumped through the process. Another thing that irked me was the way the local healthcare system worked. You couldn't just pick a clinic, you couldn't just pick a local doctor. You had to call the hospital, get put in their system to be basically, to have your name within a hat. A physician would draw your name out of the hat and decide if they wanted you for a patient. If they didn't, your name went back in the hat, and round it went until you finally got a physician through the local hospital system that would accept you. So it took about a month for us to get assigned a physician for my son through, and I won't name the name of a corporate hospital, but it's in the Joplin metro area, because at the time we lived over in Missouri. So anyway, fast tracking the story just a little bit. Good doctor, good service. Hospital, not necessarily great, but after the initial visit, the radiology, going back for the follow-up visit, it was $400 out of pocket. $400 out of pocket. It was a very mild irritation, luckily. They got it cleared up pretty quick. My son came out of it great. $400 out of pocket for one instance. Okay? Now, can we compare that to $435 freaking dollars coming out of the paycheck of a single parent a month for health insurance, which is basically a gamble on whether or not you are going to get sick or injured. That's it in a nutshell. These excessively high prices you are paying, gambling on whether or not you're going to get hurt or sick. All right. So for the breakdown, as far as the runaway insurance train, everything in a hospital has to have a specific type of insurance, right? So a hospital is operated. It's MRI. Say an MRI. A patient has to come in for an MRI. Every piece of technology going into that MRI had to be insured throughout the process of building that machine. Now the machine's in play. The machine's excessively expensive, not just because of the technology, but all the insurance along the way that's tagged onto it. Now the hospital has to carry insurance for that machine. So they get the machine, they're trying to get the machine paid off, whatever, so they have to raise their prices. Hospitals raise their prices all the time. Okay, we know this to be a thing. So now they raise the prices. The insurance company catches word they raise their prices. So the insurance company's like, oh, this customer of ours, being the hospital, just raised their prices. That means they can afford an extra insurance bump. They bump the cost of the insurance up. So now the insurance has gone up a little bit. That travels down across the board. The hospital, a year later, is like, our insurance went up this last year. We have to charge just a little bit more. And so on and so forth. Over and over, it leapfrogs. And that's the runaway insurance train when it comes to our healthcare in a nutshell. It's more complex than that, but that is the cut and dry, simple version of that BS, right? So, insurance companies, as far as private healthcare, guys, since 2020, the average health insurance has gone up by 26% and is expected to go up by 30% by the end of this year, 2026. So within 26 years, health insurance costs for the average family up by 30%. Okay, and some experts say quite a bit more. Sorry if you tapping. I spin sometimes and you tapping. Sorry if that's transferring over. So since Obamacare was initiated and went into law in 2014, that Fair Health Care Act or whatever they're calling it, just since 2014, some experts are saying that, and you can look this up yourself, those costs have tripled on certain insurance costs, on health insurance. In 2025, the base coverage alone, just in 2025, just the year of 2025, went up across the board for the average family 5 to 7%. And the average family is paying upwards of $27,000 a year for healthcare costs, for family coverage. When you average in just what they're paying as far as their not even deductible, but that's what they are paying from the paycheck into insurance. It's ridiculous. How do we fix this, guys? How do we fix this? This is something that I've thought long and hard about, and if I was in charge, if I was the one going to be fixing this, and hopefully this doesn't get me taken out by some insurance assassin or some weird crap like that. Conspiracy theories are what they are, but I don't know. Some of these theories are coming out to be true, But very first thing I would do, ban lobbying. Now this would fix a lot of problems with a lot of BS, guys. Ban lobbying. Make lobbying illegal. Then prosecute lobbyists. Prosecute them. Prosecute politicians that accept gifts and this and that from lobbyists. Okay? Stop the legalized organized crime that is happening every day in Washington. I said it before, I hate getting into politics. I don't want to get into politics on this channel. No, I want this to be nice, easy going, that this is Weekly Rant Wednesday, right? So first and foremost, ban lobbying and prosecute. Don't just threaten. prosecute. All right? And I'm not talking club fed. I'm not talking club fed. Send these suckers to places that our rapists and murderers would go to. There needs to be consequences. There needs to be consequences for long-term screwing over the American people. The next thing I would do, and I hate blanket laws because you pass a blanket law. Again, Obamacare, I know a lot of people have good things to say about Obamacare. But any time you pass a blanket law, it tends to hurt more people than it helps. But in this case, I would like to see a law passed saying that it is unlawful to charge anybody more than 2% of their yearly income. Not just their yearly income, but their yearly take home. Make it illegal to charge more than 2% for health coverage. And make these insurance companies figure it out. Oh, you might not be able to get your yearly Lamborghini or your yearly Ferrari if you're an insurance executive. But guys, these insurance companies, they have way too much control over our private health care, right? They can control your meds. They can control your physical therapy. And a lot of times it's not even a physician that is telling their bosses at the insurance company this is not medical necessity, right? This affects heart treatment. This affects cancer treatment, which my mother just dealt with a year and a half ago. It's not right. When I had my rotator cuff repair surgery, right? My surgeon, he wanted, and he wrote out, he wanted me to start with 24 physical therapy sessions. My insurance cut me off at 12, declaring it was not a freaking medical necessity. It took an extra year for me to get back what I got, and that's because I do it on my own. Because if I was going to pay out of pocket, it was going to be over $300 for a half-hour session of physical therapy at my local hospital. Ridiculous, right? Make sure I got everything. So one more thing. Physicians' offices used to have their own phlebotomists. I know mine did. And my current doctor, I talked to him about this, and one of the reasons a lot of private practices stopped doing phlebotomy in their own office and started making patients go to a third-party lab was insurance. Insurance companies made it to where it was not financially feasible for physicians to draw blood in their own offices. Okay? And phlebotomy used to be, and for you, those of you that don't know what phlebotomy is, it is a phlebotomist is somebody who draws blood, who draws and works with blood. Right? That's basically it. I've gone way over my time, but Rant's getting fired up, right? And it is Weekly Rant Wednesday. So, got that off my chest. I can breathe a little easier until I pay my next insurance premium or go to the doctor again. But I love y'all. Take care of each other. Guys, there's a lot of people in need. We need to look out for one another. We're all human beings. I try to watch my mouth, but I don't give a one fuck your race, color, creed, sexual orientation, anything like that. We need to be taken care of each other. Alright? We need to obey the laws of the land and just take care of each other. Love y'all. I hope you have a good Wednesday and a good day.